Hello, this is Dr. DeLopo. I'm a doctor of acupuncture and Chinese medicine. I'm a licensed acupuncturist, and this is my 25th year in practice. This is the first time that I'm going to be doing two different angles because the information I want to share today is specifically for my fertility patients. I've done at least maybe 100 women's health, men's health videos. At least 75% of them in my 25-year career have been on fertility. And this is, I really want you, anyone, if you're 35 and over, I want you to know you can do it, you will do it, but you got to follow some of my protocols, if not all of them. It is very important to consider my protocol if you're over 35, whether it's natural IUI or IVF. If you go to elementsinharmonyacupuncture.com, you'll see that that I have a pretty good track record when it comes to fertility. And the reason why I'm sharing it here right now, this particular topic, especially for men's fertility, I'm going to discuss about women, but especially men's fertility, because there is a lot of pressure on the women to get pregnant here. And I have done so many videos where I really discussed how, the National Institutes of Health, Mayo Clinic, and so many studies at the time that I did the videos showed that a third of the fertility issues are women, a third of the issues are men, and a third of the issues are men and women. By now you should have received quite a few of my fertility newsletters. I've condensed many of them in the 2024 fertility newsletter and the 2023 fertility newsletter. I've talked about sex, I've talked about men's health, I've talked about women's health, but there's a lot more research now, and I have new fertility patients. What I do want to share with you is that the years, I started in 1999, the years between 2019-20 until 2023, especially 2021-22, my success rate was like 90+% with live babies, breathing, powerful, healthy babies. And that was especially during the time where I really threw down the gauntlet and made people follow my protocol. And if they didn't, I didn't accept them as patients. I let them go. Now I have a daughter who's 20, who's finishing her second year in college. I have a 13-year-old, and I have a 6-year-old whom I had conceived naturally at age 43. You're looking at a 50-year-old woman who's been in practice for 25 years. I really take this work seriously. My 6-year-old is a second-year kindergartner. I mention my age because I do walk my talk. So I'm going to go straight to some of the studies that I found online. In case I post this, just want to let you know I'm looking directly at my cell phone over there. This is just for a backup. So I'll probably end up posting both. I just want to make sure that the data that I share here is not going to get lost, the video that I do. So I'm going to be reading from National Institutes of Health, Forbes, and some other Cleveland Clinic and some other credible sources, okay? So nothing about Chinese medicine. If you want to know my track record, go to elementsinharmonyacupuncture.com, which is my third website. But when it comes to fertility, I really want you to understand, especially for men, you can do it. You and your wife, you're now in a better place. You're over 35. If you're in your late 30s, 40s, my oldest woman was 50. If you are a man over 35, you really need to consider your age. And you really have to understand that, my husband is as pragmatic as they come. He is a systems engineer. He just looks at things for how they are. And one thing that he shared with me is when he hears that women are primarily the ones coming in for fertility, the first thing he says is, well, that seems pretty archaic to think that it's the woman's issue and not on the men. So let's start
with the first one. This is in order. Please take the time to hear this. You should have now by now seen my happy, healthy, hot, horny videos. You should have seen the how to prevent blue balls, atrophy of the clitoris, dry vagina, the importance of orgasms. Those are the fun videos. Please watch those. This one's going to be a little more intense in the sense that this is data that you really need to understand. If you are a man over 35 and you think the woman is the one who's having the issue, where you are now, think of your life in 10 years. So 43, I had a baby. My kids were 13, 7, and 0. And now I'm 50, enjoying the fruits of my labor, literally enjoying the fruits of my labor. And I am a practitioner and a business owner. I'm a doctor of acupuncture and Chinese medicine. I'm a licensed acupuncturist. I'm board certified. I know what it's like to have a career. I know what it's like to have to pay a mortgage. I know what it's like to put my kids through activities. I know what it's like to pay bills. And somehow I managed to make it. There's no such thing, I can tell you as a fertility specialist, there's no such thing as the perfect time. Right now is a perfect time. If you want to wait till you have the house, wait till you have the car, wait till you have the career, I hope by now in your late 30s, 40s, that you've established yourself in that part of your life where you have some, if not all of the material things that you want. One thing that you cannot take back is your age and your fertility, especially your wife, but including you. So, Forbes, how male fertility changes with age. All right, so what I'm going to do on my site, because I don't think I can put this all on YouTube because there's only so much space that they give you to type. I'm going to put it on my page and you'll see all the citing. Another study of intrauterine artificial insemination. So we're going to discuss natural, IUI, and IVF, okay? Another study of intrauterine artificial insemination found that after 6 cycles, men who were 35 or under had a fertility rate of 52%. That's after 6 cycles. Whereas men over the age of 35 had a fertility rate of 25%. And that's in Forbes. Let's go to that page and see if there's more information there. And the name of this is How Male Fertility Changes with Age by Becca Stanek. Let's see if there's anything. This talks about as men get older, the quality of their sperm can decline, among other challenges, leading to overall declines in fertility. However, age is far from the only factor at play when it comes to male infertility. Other causes include structural issues in the genital tract, genetics, hormones, and lifestyle changes. Fertility challenges are far from uncommon, and there are treatments available. So I won't go too much into that, but just want to let you know the first one is Forbes. We're going to go into the heavier studies. National Institutes of Health. That is a government website. Fertility in the Aging Male, a systematic review. There's no higher review. Okay, a systematic review, you can count on this. In one study, Dunson et al. Found that 18 to 28% of men aged 35 to 40 years were unable to achieve natural pregnancy with their partners within 12 cycles. Pascalato et al. Showed that the probability of conception in over 12 months doubled from 8% to 15% when comparing to under 25 men to over 35 and over men. I'm assuming their ages. I don't know exactly what that means. Let me go directly to that site. So here it is in the Fertility in the Aging Male, a systematic review. Masaya Jimbo, medical doctor, PhD, Jason Kunisaki, BA, Muhammad Ali Gayed, MD, and then there's quite a few others. The abstract, which I'll read here, The negative effect of advanced female age on fertility and offspring health is well understood. Okay, if your woman, if your partner, if your wife is over 35, there is concern. I'm concerned. I had my 3 children. They were conceived naturally at 30, 36, and 43. Something you need to understand is that I started receiving acupuncture 1 to 5 times a week since I was 20. So you're looking at a woman who has had acupuncture 1 to 5 times a week since I was 20. It's been 30 years now. So, continuing with the abstract. In comparison, much less is known about the implications of male age on fertility, with many studies showing conflicting results. Nevertheless, increasing evidence suggests that advanced paternal age has negative effects on sperm parameters, reproductive success, and offspring health. Herein, I hope you heard that, offspring health, that means the health of your child. Herein, we summarize the current body of knowledge on this controversial topic with the belief that this review will serve as a resource for the clinicians providing fertility counseling to couples with older male partners. So the keywords of this on the National Institutes of Health are male infertility, andrology, paternal age. If you go to elementsinharmonyacupuncture.com, you'll see that I did, just type in sperm, and you'll see that I did a video, 2 videos on sperm motility. And sperm motility, the first video, same man, he was 35, and I got the sperm motility from 2% to 42%. The threshold is 40%. And in the video, I shared that one study in Texas recommended 50%. Now, when I got it from 2% to 72% to 42%, that was 20 treatments in 2 months. And in a total, so this gentleman, he runs a family law practice. We got it, and he's a normal dude, regular dude. He's the one who found me. He was the one who made sure his wife was coming to see me as well. When he would come, he'd come in, serious business. You know, he wasn't here to do the whole 1 to 3 hours. He was like 45 minutes. That was the bare minimum that I said that I needed. And he had his alarm go off. He gave me 10 months. I got it from I went from 2 to 42% in 2 months, 20 treatments. The rest of the 8 months, we got it from 2% to 72%. So he took those studies seriously, and he took my work seriously. He was the one who found me. He was the one who made sure his wife came twice a week. He was the one who made sure that he was going to definitely achieve the goals that he wanted, which they do have a baby. That's important. When my kids were born, they were born 7, 8, and 9 pounds. We're not just talking about getting pregnant. We are talking about making sure that mommy has a baby who is thriving. Just because she gets pregnant doesn't mean she can carry that pregnancy. In many of my videos, I say I care more about the sperm than I care about the egg. And one of my, there are several newsletters that I've done. One of them is either, let me see, it's elementsinharmonyacupuncture.com, and the newsletter is Dreams Come True newsletter. So elementsinharmonyacupuncture.com/dreams-come-true-newsletter. And in that newsletter, we talk about her value, her her uterus, and how it improved. The quality of her uterus improved, and how it went from looking like an advanced maternal uterus, advanced aging decline, to by the time it was her 10th month working with me, mommy had a beautiful uterus. The doctor actually said, "What's going on? Your uterus actually looks like that of a 27-year-old. I do the same thing when it comes to men's health, making sure that the sperm motility, morphology, mobility are perfect. That is critical to me. And so we can do it for men and for women. Let's go back to that page. Regarding miscarriage, several studies found that APA significantly increased the risk of miscarriage. So relationship between paternal age and natural unassisted pregnancy. When a woman, if a woman unfortunately suffers a miscarriage, as a clinician, someone who's been studying Chinese medicine since 1994, someone who's been practicing Chinese medicine since 1999, someone who has said so many times in so many videos, I will never specialize in fertility, and now this is my specialty, is the most challenging fertility cases. I can tell you that when a woman, unfortunately, if a woman unfortunately suffers a miscarriage, which I've done a miscarriage video, I also did a video that daddies suffer too, daddies hurt too. A lot of it is not just because, I say this as a clinician, it's not just because of her egg, it's because his sperm just wasn't a high quality sperm. All right, so that is the second. I want to keep each thing as brief as possible. Male infertility decline. Studies say the real deal. This one is in extendfertility.com. Let's go to that page. All right. So this was posted 2018. All right. Women are born with the eggs they'll ever have, known as their egg count or ovarian reserve. And then we talk about that. Now, in this same page, we talk about what causes fertility decline. Medical issues, illness, anatomical problems, chromosomal defects, problems with sexual intercourse or ejaculation, DNA fragmentation. Environmental or medical history factors, lifestyle, illicit drug use such as anabolic steroids, cocaine or marijuana, alcohol use, smoking, obesity. Male infertility decline and age. This is what I want to talk about. In another study of 901 cycles of intrauterine insemination, a treatment, I lost my spot. Let me see. In another study of 901 cycles of intrauterine insemination, a treatment for infertility, men over 35 had pregnancy rates of 25%, compared with pregnancy rates of 52% in men under 35 years. So we dropped 35 and younger, 52%. 35 and over 35, 25%. Suffice it to say, age-related male fertility decline is well established by research. Very similar, they probably got this information from National Institutes of Health. So what causes age-related male infertility decline? I can explain to you from a Chinese medical perspective, but I'm going to read directly from here. If you want to know about the Chinese medicine part, we will talk about that privately, okay? So the first thing they share is decreased sperm motility. I already shared that. I also did a video on sperm, and in that I cite from a blog that they researched 3 PubMed studies, pubmed.gov. And in that, it shows that men, their quality of sperm goes down, declines after 48 hours. You should not abstain from sex. And something that I share here, I say it a lot in my Healthy, Happy, Hot, and Horny, the 4 H's, Healthy, Happy, Hot, and Horny. In those videos, I talk about how you got to have sex throughout the month. After 48 hours, sperm quality decreases. So the reason why I need you here, gentlemen, 4 times a month, not just mommy. Mommy has her acupuncture protocol. She needs to be here. If you don't know the acupuncture protocol, contact me. I will send it to you. You got to have there is an acupuncture protocol throughout the month. During your cycle, during your period, right after your period, during ovulation, and right before you have your period. That is until the day you get pregnant. Daddy needs to be here 4 times a month. In fact, even when I'm working with 2 women who are married or partners and they're doing IVF, I need mommy to be here. They're supporting mommy to be here 4 times a month. And there's a whole category with that, which I won't discuss. There's a whole reason why. But for you, daddy, I need you here 4 times a month. So many things happen to mommy physiologically. Her libido will increase so much. And I've done those videos, but I'm going to tell you right now, something happens to our oxytocin when you're here showing your support. And I get to work on you. I get to work on what we call your kidney chi or your jing. I'm not going to describe that here, okay? But once I talk with you privately, I can have a really good conversation with you that is just going to be very straightforward, very straight to the point, very concise, so you understand why you need to be here. I need the sperm more than I need the egg. What causes age-related male fertility decline? Again, in this case, we're going to talk about 35 and over. Decreased sperm motility, did a video on that. Decreased sperm morphology. When I'm working with men, whether it's for motility, morphology, mobility, I'm working on all of it. Decreased seminal volume. How age-related fertility declines differs from age-related female fertility decline. This is something to really understand. Unlike low egg quality in women, abnormal DNA in sperm, also known as DNA fragmentation, is not primarily caused by age. Men of any age can experience sperm DNA fragmentation, which is thought to be caused by infection, elevated body temperature, such as a high fever, or lifestyle factors, such as smoking or drug use. I'm going to let you read that on your own. extendfertility.com/male-fertility-decline. Again, I'm going to have these links in on the page. The next one is Unexplained Infertility by Cleveland Clinic. Unexplained infertility, also known as idiopathic infertility, occurs when fertility tests don't reveal a cause. A healthcare provider will only diagnose unexplained infertility after both partners have had complete fertility evaluations. Some possible causes include underlying conditions, celiac disease, diabetes, or thyroid conditions, endometriosis, which is pelvic adhesions, can distort pelvic anatomy, decreasing the chances of the tube being close enough to the ovary for egg pickup. By the way, if you go to elementsinharmonyacupuncture.com, you will see a testimonial on stage 4 endometriosis. I have women here and I have friends who have had endometriosis, who currently have endometriosis and have had one or more babies, just to let you know. Ovulation problems, poor egg quality, low sperm count, or poor sperm motility, lifestyle factors, smoking, heavy alcohol, age, weight, and sexual history, autoimmune disorders, lupus, erythematosus, Crohn's disease, rheumatoid arthritis, or other autoimmune diseases, cancer. The disease itself, along with treatments such as chemotherapy and radiation, can greatly diminish or damage sperm and eggs. So 2 things on that. I have a testimonial by a mommy. I gave her 2 babies, and I helped her with fertility post-cancer. So she had cancer prior to working with me, and we strengthened her body. So then post-chemo, post-cancer, she was able to have her babies. So, and also I've done, if you go to elementsinharmonyacupuncture.com and look up acupuncture integrative oncology. Integrative oncology, I just basically read from JAIM, Journal of Acupuncture and Integrative Medicine. They did a wonderful just its own journal just on integrative oncology with acupuncture, and I just read from the abstracts. It's an amazing journal, and they just really went into a lot of research, and I did a video just reading from the abstracts. I have patients who are still alive, whom I had helped or helping currently. There's one video where I said the woman told me she had 3 months to live, and that was over 4 years ago. I said, cancel. I didn't just hear that. She told me I have 3 months to live, and I had to dispel that belief. And she's still alive, and she just saw her daughter graduate with I believe her master's degree last year. It is 2024. When she told me this, that she had this much time to live, we had to focus on why. And before we go forward, why is your wife here? And then more importantly, why are you not here? But a lot of my daddies, my couples, and you'll see those videos where daddy and mommy are here. Those people that I helped, and they were both here, they got pregnant so much faster. I asked one couple, I asked for 3 years. They were over 40. They had 5% chance to get pregnant, 4 failed IVFs, 1 fallopian tube. Nothing was wrong with the dad. Nothing was wrong with the dad. He had a very high libido, very strong constitution. And I asked for 3 years and they got pregnant in 6 months. And I break it down in the video, how many treatments. You know why he listened to me? Because he's in research. He's a physician. He's a Western medical doctor. And the wife was also a CEO of another company, and she was a nurse practitioner. And I talked to them like they were a younger brother and sister. And I said, what do you guys want me to do? And they said, we really want you to help us get pregnant naturally. And I said, then you better follow my protocol. And they did. And we had a lot of coming to Jesus moments. And they followed the protocol and they got pregnant in 6 months. They showed up and we had some challenges, but it happened in 6 months when she got pregnant. And that was her egg and his sperm. And I did this video so many times, but I really broke it down in that testimony, in that video, that specific one. And she wrote a testimonial. Mommy and Daddy just sent me a video of Daddy at the river with the daughter playing. And this was on Mother's Day, just on Sunday. They sent me a video and I said, your life is so different. Prior to having their baby, it was go, 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 trying to fit fertility into their busy lives. And guess what? As a mother of 3 children, it's the other way around. If you really want to be a parent, my daughter, my middle one, takes 13 hours of dance. She's in 4 dance teams. One of them is a solo, and she plays violin. And she's a great jiu-jitsu fighter. I coach, I help coach. My husband's been training since 2006. I'm a brown belt, my husband's a black belt. My daughter just got another stripe on her yellow black belt. My daughter's a gray white belt. My oldest used to train, but now she does other things. She almost broke my arm in a personal protection class about less than 3 weeks ago. And I'm proud of that. We're busy. My son swims, he takes swimming lessons. My oldest daughter was concert mistress. She also competed in dance. I know what it's like to be busy, but guess what? As a parent, you think you're going to fit your life around your work. No, you got to fit your work around your family if you want to be close. People are often surprised that my 20, 13, and 6-year-old are so close emotionally. They are very close. You got to have a heart-to-heart with each other, husband and wife, partners. You got to make it clear to each other, what are your goals? What are we doing? Because your why is going to carry you through things. Your why is going to carry you through financial challenges, time challenges, fitting each other in, time, money, relationships, health, freedom. My grandmaster, Dr. Richard Tefutan, would always talk about time, money, relationships. Those are the 3 top things that people would stress out about. And along with that, I add health and freedom. In this case, we're talking about health here. It's not just mommy's issue. So let's continue on. So let's go to that. That's the Cleveland Clinic. Unexplained infertility. Cleveland Clinic, mike.clevelandclinic.org. And I'll send you that. I'll have the link on my site. Let's go down. What is unexplained infertility? No uterine abnormalities or structural issues with your uterus. Ovulation occurs at regular intervals. Your fallopian tubes are open with no obstructions. Your egg count is good. The ovarian reserve. The brain produces normal levels of hormones needed for reproduction. Your partner's semen analysis normal, count, amount, motility, and shape. People diagnosed with unexplained infertility have been trying to get pregnant for at least 1 year if you're younger than 35 or 6 months if you're over 35. Fertility treatments and assisted reproductive technologies, ART, like IUI, intrauterine insemination, and IVF, in vitro fertilization, can help couples get pregnant. Now, if it's just simply mommy's ovulating, let's put the sperm, then it should work 100% of the time, right? And I wish that were the case. And in many videos, I've shared what the success rate is. And it goes down with each try. There's something magical that happens with acupuncture. I'll let you read those on my website. We're just going to focus on the Western medical aspect. But I will tell you that acupuncture does so much for men's health and so much for women's health. Like I said earlier, one of the videos that I did, mommy said her fertility specialist said, what are you doing? Because your uterus looks like that of a 27-year-old. And it was only then, at 10 months of working with me, for natural fertility. A different couple who also had 4 failed IVFs. Those cases were pre-me, pre-Dr. DeLopo. Also working with other acupuncturists. But there's something special that happened here. So they asked her, we'll call her Jay. They said, what are you doing? The doctor said, what are you doing? And she said, I'm working with a new acupuncturist. I actually said, don't tell him you're working with a new acupuncturist. You need to say that you're working with me, Dr. DeLopo, because there's a special protocol that I have. And then and only then did Daddy at 10 months start to work, because she was doing my entire protocol. But he was resistant. She quit her job the year before that. She had been, she was in finance. And she quit her job the year before. And she was doing everything I asked her to do. She had already quit her job before working with me. As soon as he came here, I got her, the only thing I could not change, I got everything great. Her period was perfect. I really changed that. Her uterus was perfect. But I could not get her libido up. Her libido stayed at a 2 for 10 months. And then when Daddy came, her oxytocin increased. All of a sudden, her libido's at a 10 on a scale of 1 to 10. And guess what happened at the 12th month? 2 months in working with me, they got pregnant. And that's when I said, again, when Daddy and Mommy are working with me, so much faster. I don't know what else to tell you except show you my results. You're looking at someone in 25 years in practice, not 5, not 10, not 15, not even 20. I put in my time. How many shots did Michael Jordan have to make? You know, he has the most, I don't know if it's changed, but supposedly from all my personal growth training, he has made the most shots, but he's also missed the most shots. You got to put in the work. This is, you know, tell me what you do day in and day out for 10 years. And that's what you're going to be really good at 10 years from now. I think we can agree on that. This is all I've been doing, figuring things out. There only so much that they taught us in Chinese medicine school. There's only so much they taught us in Chinese medical school. Everything that I have learned to achieve the results on my third website, elementsinharmonyacupuncture.com, which there are a lot more testimonials that I did not move from my old website, moveyourchi.com. I mean, I myself am a living proof that I had strong babies, my second and third at 36 and 43. And my periods were perfect. It's important to understand that both men and women you gotta consider both men and women when it comes to inexplicable fertility issues. I don't like to use the word infertility, but inexplicable infertility issues. So let's see where it is when it comes to this. Well, we read from that already. I will share that particular. Now, the next one is how common is infertility? This one is also another one from from the National Institutes of Health. This is what I always refer to about how common is infertility. This is National Institutes of Health, Eunice Kennedy Shriver, National Institute of Child Health and Human Development. All right, about 9% of men and 11% of women of reproductive age in the United States have experienced fertility problems. In 1/3 of infertile couples, the problem is with the man. And 1/3 of infertile couples, the problem can't be identified or is with both the man and the woman. And 1/3 of infertile couples, the problem is the woman. So it's pretty equal. Studies suggest after 1 year of unprotected sex, 12 to 15% of couples are unable to conceive, and after 2 years, 10% of couples will still not have a live-born baby. Very important to understand that. Live-born baby. I don't care about studies that show pregnancy positive. So I graduated with my master's in Chinese medicine in 1998. And after 20-something years, 22 years, that's when I started studying for my doctorate. 21, 22 years. And I graduated. And if it matters, it was all A's and 189%. I took my doctorate very seriously. And that was after having my career. That was after buying a house. That was after having 3 kids. My son was 2 years old. And during the doctorate, we broke down some IVF cases. And one thing, because I had as much, if not more experience than some of the professors, they were happy for me to talk. It was a very, in our doctorate program, we had to participate a lot. And I shared, most women do not care about just pregnancy if they've had one or more miscarriages. What matters is live birth. One thing that I share in the videos is there's no such thing as a 90% success rate. You either have full baby or you don't have a baby. So, in couples younger than age 30 or who are generally healthy, 40 to 60% are able to conceive in the first 3 months of trying. With baby number 1 and 2, when I was 29, I gave birth at 30, and then again at 36. And just because a person has a baby doesn't mean that they don't come in here crying that they can't have a second, third, or fourth baby. My mom had me at 21, and she was never able to conceive a second child. It was very sad, and she did do medications. The medications in the 70s, and maybe in the 80s, not sure, I was born in 73, are probably nothing like how they are now. But there's a reason. People ask me, why do you think people can't get pregnant? And I have my reasons, and I'll discuss that with you privately. But stress is a very abstract word. You have to understand that with our first and second, when we were, I hate the word trying to conceive, but when we were, let's have a baby, it happened rather quickly because I was doing acupuncture and herbs, and so was my husband. At 43, we were just having hot sex. I don't know what else to tell you. I talk a lot in the videos about healthy, happy, hot, and horny. I talk about the importance of lingerie. 2+ weeks ago, I did 3 videos in 1 week on lingerie. Go to elementsinharmonyacupuncture.com/lingerie. Why would I do 3 videos on lingerie? Why would I do videos on what turns women on? I'll give you a little synopsis. 60-minute video, 50 minutes is on service for women, like cleaning the house. So for Mother's Day, I paid for a cleaner to clean the house because that was important to me. That's what I wanted for Mother's Day. And there was a facial available, so I got a facial. But guess what mattered more to me? The house was spotless, or as clean as possible. It's important to understand. Oh, and in that video, the last 10 minutes, what turned men on, according to research, was like pizza and popcorn and stuff like that. And when I bring that up to men, they're like, oh, so like fun things that make them feel like it's fun. Whereas women, it's acts of service. I just did a video for Mother's Day, which was 3 days ago, and I talk about what moms need. And typically it's an act of service. So, anyways, I'm going to reread this. Fertility declines with both age in both men and women, but the effects of age are much greater in women. In their 30s, women are about half as fertile as they are in their early 20s, and a woman's chance of conception declines significantly after age 35. Male fertility also declines with age, but more gradually. So that is the National Institutes of the U.S. Department of Health and Human Services, National Institutes of Health, and the title is called How Common is Infertility? Then we have, we just went over that. There's one last one. This was Men's Med Blog, Aging, Men's Health, Your Pregnancy Matters. This is written by 2 medical doctors. Who are they? They are Lean Al-Hafez, MD, Obstetrics and Gynecology, and this one is, she's not a medical doctor, Heather Fisher, MS, Obstetrics and Gynecology. How does aging impact male fertility? Several studies have shown fertility rates decline as a man ages. A 2020 study found that conception is 30% less likely for men older than 40 than it is for men younger than 30. There are several reasons for this, including that semen volume, total sperm count, and sperm motility, how well the sperm can move toward the egg, all decrease as men age. Many potential age-related factors contribute to these changes, such as declining testosterone levels, decreasing blood supply to the pelvic area, which that's part of what acupuncture does. My great friend, Zen Tuan, she's a colleague of mine, healing with Zen. in Pasadena. She did this very amazing video talking about what acupuncture does for fertility. And one of the things she says is that we provide circulation, better circulation in the pelvis area. Shrinking or softening testicles, benign prostatic hyperplasia, BPH, or enlarged prostate, which I did a video on the benefits of orgasm. The more orgasms, the more sex a man has, the prostate tends to shrink and his chances of prostate cancer goes down. Mother Nature is very fair. I had read when I was pregnant with my first child that if a woman nurses for 7 years in her life, her chances of breast cancer goes down to 0. So therefore, with all 3 kids, I nursed total of 8 years. And if it matters, till this day, 20, 13, and 7, they have never had to take antibiotics. If that matters to you. I nursed the first one for 2 years and 4 months. I nursed the second one, I wanted to nurse for 3 years. She ended up nursing for 4 years. And then the third one, I nursed for barely a year and a half. Don't get the stuff at Target. You got to take my herbs. That's why the second one was able to nurse for so long. One thing that I had done, one of the videos, I talk about the disparity between men and women, research when it comes to men and women's sexual health. With men, I think it's fair to say when it comes to erectile dysfunction, there's at least $100 million of research for erectile dysfunction, if not $1 billion industry. When it comes to women's health, I did videos on, like I said, dryness of the vagina and atrophy of the clitoris. Your clitoris will disappear if it's not used. In those videos, I had shared that there are 3 levels. I got this information from Montauk Chia, from London Rose, with Brian Rose. I think that's his name. So Master Montauk Chia explained that there are 3 levels of orgasms. The third one is uterine orgasm. How they did the studies, I don't know. But and I had heard it from other studies as well. I think they were conducted in London in the 50s. I'd have to redo the video and redo this research. But there are 3 female orgasms, which most women don't know. And only 15% of women in the world experience this uterine orgasm. I don't know how they did the research. However, here's the thing. When women experience the uterine orgasm, her chances of uterine cancer goes down. So if sex allows a man to shrink the prostate, and that's what I'm going off the top of my head from the videos that I've done before, and it's like, wow, your chances of prostate cancer goes down the more sex you have. I always talk about hot sex, healthy sex, amazing sex, not just sex, okay? It's got to be both partners engaging and happy. And if a woman's chances of breast cancer goes down to 0, the more years you nurse, Mother Nature will, pay you back by lowering your chances of breast cancer. The third one is when a woman experiences uterine orgasm, her chances of uterine cancer goes down. That's important. And then we talked earlier about quality of sperm goes down after 2 days. And so in that study, they were in that blog, based on 3 studies, they were talking about how it's important for men to have sex at least twice a week. And not just during ovulation, but throughout the month, so that you're spitting out, you're literally giving good sperm every time. When I got pregnant at 43, we were doing the natural method. And that's why I don't care about when you're having ovulation, because you should be having sex throughout the month. My husband's like, I thought we were doing the natural method. I said, I promise you, I was not ovulating during that time because I'm like clockwork. And this has happened so many times with my other patients where they weren't ovulating. Their doctors told them you can never get pregnant because you're not ovulating, and boom, 2 babies, because we were working together and I was doing acupuncture, and next thing you know, the mom's having babies. Or another woman, I gave her 2 babies, and then she started coming in to relax because she had 2 babies. And I said, well, you got to use a condom. Or if you want, I'm not a big fan of birth control pill, but if you need to, then, use a birth control pill, because you're going to have to practice safe sex. She goes, no, we're doing the natural method. I said, well, you know how I feel about that, because I had a baby at 43 doing the natural method and being super careful and having a 9-pound baby. Guess what? I'm on my date night, which you should be having every week religiously, dressed up, dolled up, putting forth the effort. If mommy has to pay $25 to $150 a month on new heels and lingerie, you guys gotta do those you guys gotta do lingerie nights. You guys gotta do the date nights, okay? So she got pregnant with her 3rd baby, and then after that, they got fixed. Narrowing of the vas deferens, which are the tubes that move sperm from inside the testicles. If you are concerned about whether age has affected your fertility or your partner's, the UT Southwestern Male Infertility Clinic can conduct a semen analysis. So this is, let's see, uts.org medblog. And how does a father's age affect fertility and baby's health? So, again, declining testosterone levels, decreasing blood supply to the pelvic area, shrinking or softening of testicles, benign prostatic hyperplasia, also known as BPH or enlarged prostate, narrowing of the vas deferens, which are the tubes that move sperm from inside the testicles. Can age cause genetic mutations in sperm? A woman is born with all the eggs she'll ever have, but a man is constantly making new sperm cells that divide and replicate about every 16 days. By age 20, a man's sperm cells have gone through about 150 divisions. That number could grow to 800 by the time he's 50. The more times sperm cells replicate, the more chances there is for a genetic mutation to occur. Pay attention, gentlemen and women. Ladies, fortunately, most genetic mutations are benign, meaning they won't cause any harm to a baby. I'm going to let you read that on your own, but it is very important that you seriously consider the studies that I've shared here. This is one of my more serious videos. One of the protocol is daddy needs to be here 4 times a month. I know acupuncture is not one of the most favorite things for men to do, but your wife's, if you want her to give birth, what do you think birth is like? Do you think it's easy? Do you think it's fun? Whether she decides to give birth at home or in a birthing center or in a hospital, whether baby comes out vaginally, naturally, the way God intended, or through the sunroof, a C-section. If you want a healthy, happy baby, powerful, strong, your baby, you really need to consider some of the sacrifice you might have to make. If it's like 6 or more months, you might want to really consider, what are we doing? Should we consider doing Dr. DeLobo's fertility protocol? All right, I hope this really helped you. I really want you to know you can do this, but mommy really needs you. She really, in 10 years, you can either, there's right behind me on this camera, you can see the picture of my family. I got 3 kids, but in this angle with my phone, you don't see the picture of my kids and my husband. You plant the seeds now. You've been in your career 10, 20, 25 or so years. You put in the time. Now it's time to make a baby. All right, take care, Element.